Welcome to Illinois Health Matters Visualizing Healthcare Reform. We designed this interactive data tool to help people understand what the Affordable Care Act will do in 2014 for Illinois' uninsured population. Who will get insurance and how? Click or touch anywhere on the screen to begin. Let's start with the state view. Click on the statewide button in the upper left corner of the screen to see info on the whole state of Illinois. You can use the zoom buttons to zoom the picture in or out. Read about how healthcare reform will impact the state as a whole on the right side of the web page. 13% of Illinoisans, over 1.6 million, are uninsured and will gain access to health insurance coverage in 2014. The info bar also shows you how those people will get insurance coverage. Those who are below 138% of the federal poverty level will be eligible for Medicaid. Those who are between 138 and 400% of the federal poverty level will receive tax credits to help them afford purchasing insurance through the statewide insurance exchange, also known as the insurance marketplace. And those above 400% of the federal poverty level will be eligible to use the exchange to find and purchase coverage. But how will these reforms affect the people in my region or community? Change the view by clicking on the Region, Cook County Only, or Community Areas button at the top. You can zoom in and use your mouse or touchscreen to drag the map in order to find your community. Just like the statewide view, the right sidebar has info on the community area you clicked on. Surprisingly, many of the people in Illinois who will have new access to coverage live in the Chicago suburbs. Let's take, for example, the DuPage County region. In this region, there are about 86,000 uninsured people. In 2014, 41,000 people, almost half of all of the uninsured in this county, will be able to purchase subsidized health insurance in the new healthcare marketplace. These are people who may be employed but are not eligible for, offered, or simply cannot afford their employer's insurance. Now let's zoom in further to the community level. If you go to the city of Chicago, South Lawndale, and lower west side of the city, you'll see that almost 35% of the population is uninsured, the highest percentage in the state. In 2014, 16,000 will be newly eligible for Medicaid, and another 17,000 will be eligible for affordable health insurance in the exchange. Using the PDF button in the top right corner of the tool, you can print a report for each view and share it with colleagues and policymakers. Thank you for exploring the future of what healthcare reform can look like. To learn more about important health news and policy, go to illinoishealthmatters.org. There you can ask questions, see upcoming events, sign up for our newsletter, follow us on Facebook and Twitter, and more. For additional questions, you can email us at info@illinoishealthmatters.org.